7 things to avoid while taking prednisone. Hi, I'm Dr. Megan, your prednisone pharmacist, and lots of people ask me, what should I avoid while taking prednisone? And so today I'm here to offer 7 or more things to avoid while taking prednisone. Okay, it's not really going to be 7, it'll be 11, but 7 just sounds better, right? The reason I use the number 7 is because it starts with the letter S. And all of the things I'm going to tell you to avoid today start with the letter S. So 7 just made a lot more sense. First of all, I'm going to cover the most important things. And then at the end, I will cover another common question people have, which is what vitamins should not be taken with prednisone? So first thing to avoid while taking prednisone is smoking. Since prednisone is causing immunosuppression of your body, smoking is even more harmful than it normally would be. So avoid that. In addition, smoking can worsen the possible osteoporosis caused by prednisone. So we don't want to do that. Number 2, we want to avoid a shot of alcohol. Alcohol can worsen the osteoporosis. It can worsen the weight gain, and it can worsen the insomnia. Those are the 3 biggest side effects of prednisone, and alcohol can make them all worse. Plus, the alcohol makes it harder to recover your adrenal system after prednisone interferes with it. Number 3 is stimulants like caffeine. This isn't a hard, completely avoid it at all costs. If you're using stimulants and you don't absolutely need them to function throughout the day, it's best to avoid them. Prednisone is pretty hard on your heart, and caffeine can be hard on your heart too. So definitely avoid the really big, scary, straight sugar energy drinks while on prednisone. Definitely avoid that. But avoiding caffeine in general is wise, but is not a straight X. Next, avoid shot. This kind of shot, except only the live vaccines. There aren't a lot of vaccines that are live. Most of them are killed completely and aren't going to interfere much. And so they're okay to get. But the live vaccines, there are a few to know about that you should be warned. First of all, the flu mist, the nasal spray version of the flu shot, you should avoid. The injectable version is totally fine. So get the flu shot. I have a whole video in depth all about the flu shot, whether or not to get the flu shot while on prednisone and the best timing. Other shots that are live may include the MMR shot, the chickenpox shot. Most people don't need to worry about the chickenpox shot. Related shot to that is for shingles, because it's actually the same virus that's causing shingles and chickenpox. And that's usually given to adults who are over 50 who have a stable immune system. But if you are on prednisone, you don't have a stable immune system. And I want to read this important detail, this exact definition from the CDC. They said that substantially immunosuppressive steroid dose, so this is the definition of who's immunosuppressed, is considered to be greater than or equal to 2 weeks of daily receipt of 20 milligrams or a 2 milligram per kilogram body weight of prednisone or equivalent. Basically, what does that mean? If you're taking 20 milligrams or more per day for 2 weeks or longer, or the equivalent of that all squished together in one dose, then you're considered immunosuppressed. And that's when we need to be careful. So if somebody at risk for shingles, you have a family history and you've had it in the past, then there's 2 vaccines that could be given for shingles. One is Zostavax, and that's a live vaccine, and you need to avoid that while on prednisone. But the other one is called Shingrix, and it's a recombinant of the virus, and it's not live. So you can get it while on prednisone. But here's the deal with all vaccines. The lives you want to avoid, the other ones you can get, but they may not work as well because your immune system is not working as well. You might not have as robust of immune response as you were hoping for. You may need to be revaccinated after you stop taking prednisone. Talk to your doctor about the best way to proceed. But it's okay to get shots that are non-live shots, which is most of them. Most of them are just fine. The next, number 5, is NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen, which is also known as Motrin, or Aleve, which is also known as naproxen. Those are the two big ones to avoid. Celecoxib, which is Celebrex. Those ones you'd want to avoid because it's actually a drug interaction. They are both affecting similar pathways in your body, and it can lead to an increased risk of GI bleeding, like bleeding in your gut. Avoid that, but it's not black and white. Like, talk to your doctor about it. If the benefit of taking both outweighs your risk for having a GI bleed, then that's something you and your doctor can work out. All right, number 6 is avoid sugar. And this is mostly because prednisone is a glucocorticoid. That's the class of drug it's a part of. Gluco meaning glucose, meaning sugar. So if we are eating simple sugars, candy, desserts, all the things you crave while on prednisone, it's a problem because prednisone is interfering with appropriate metabolism of sugar. You're just increasing your risk of weight gain and diabetes while on prednisone. I have a whole long video all about foods to avoid, so check that out if you want to know more. Number 7 goes along with that, and that is another food type to avoid, and that's salt or sodium, because prednisone is causing us to retain salt. And so when we're eating salt, that's making it even harder on our kidneys to get the proper balance of salt and water, and that can lead to water weight gain. So it's just a lot harder for your body to do its job and can increase your risk for high blood pressure and heart complications. So you want to keep your sugar and salt to a minimum while on prednisone. Number 8 is stress. So prednisone is mimicking your body's naturally occurring hormone called cortisol. And cortisol is our stress hormone. It is secreted by your body in times of stress to save you, to get you through those horrible, stressful times, such as famine or war. And so when we have extra stress, it's just even more taking a toll on our body. So doing what you can to decrease your stress while on prednisone is wise. Take a break. Like, you're taking a life-saving medication. It's okay to give yourself a break, right? So that's one type of stress. Another type of stress is number 9, and that is sports. And by sports, I mean extreme sports. Doing normal physical exercise is fine. I'm talking extreme sports, marathons, Ironmans, triathlons, things that are very depleting and stressful on your body. We want to avoid these because prednisone, when you take it as a drug, you're taking 10, 20, or even 100 times your normal cortisol level. And when you're throwing on an extreme exertion like extreme sports, that's just a lot more toll on your body. Prednisone is causing muscle loss. It's causing issues with the integrity of your skin and bones. You don't want to be putting extra undue stress or exertion on your body while you're taking prednisone, especially while you're taking high doses of prednisone. If you need to be continuing your athletic pursuits, definitely talk to your doctor about this. But I don't recommend, if you start taking prednisone, start gaining weight and you think, oh, I'll just run a marathon. Don't do that. That's not a good idea. Don't start an extreme sports habit while on prednisone. Your body is already going through enough. You don't need to put it through that much more. Number 10, avoid sick people while on prednisone. You don't need to avoid, the snotty little kid around the corner. You can go to social events, but what we are worried about is sicknesses that can lead to pneumonia, because heart disease and pneumonia are the biggest leading causes of death in people who take prednisone. We don't want to expose you to somebody who has pneumonia. So that could be influenza, which is why you should get your flu shot, and COVID, which is why you should also have your COVID shot. You want to protect yourself from things that can cause pneumonia-like symptoms because you're less likely to overcome pneumonia while on prednisone than if you otherwise were to get it when you weren't on prednisone. Number 11 is supplements. I'm not saying avoid supplements. I'm saying avoid certain supplements. So the first one to avoid is things containing aluminum hydroxide and magnesium hydroxide. These are often called antacids, such as Mylanta, Rolaids, or Tums. Usually Tums is okay because it's usually a calcium, but we're talking about the kind that's aluminum hydroxide. This isn't a hard, don't ever take it. This is more like they did studies and it said some patients have shown as much as a 40% decrease in the prednisone bioavailability when co-administered with aluminum magnesium hydroxide. So basically, if you were to take 10 milligrams, you may only absorb 6 milligrams because 40% of it is being blocked by the aluminum hydroxide. What's happening is aluminum hydroxide is this ion thing, and it sucks the prednisone in, and 40% of it's just hiding, and it just goes straight through your gut and you never even get it into your body. So you can do it. You just need to be aware that you're probably not absorbing almost half of the drug that you're taking. Definitely talk to your doctor if you have to take aluminum hydroxide containing things. The second is licorice. So licorice root, or the Latin Glycyrrhiza glabra. The extract of that was shown to decrease the elimination of prednisone in test tube studies. In addition, if you actually absorb the licorice, it has been shown to prolong prednisone activity, which can increase your prednisone side effects. And since prednisone is causing 150 or more side effects, you don't want that. We want the prednisone to fall off normally and not be prolonging how miserable we feel while on prednisone. Finally, if you're taking licorice, it might prevent the immune modulating activity of the prednisone from even working. So it might even be blocking the prednisone altogether. So I do not recommend taking prednisone and licorice root containing supplements. Sometimes they're called adrenal support supplements. You just want to avoid those while on prednisone. Maybe after you stop, that's a totally different story, but not while you're on it. We want to let the prednisone do its job. The third supplement to avoid is St. John's wort. So St. John's wort is often used for people who have depression. And I can totally see that because prednisone often causes depression and anxiety as a side effect. Many other mood changes as well. And so people might be like, oh, I need a natural way to help me cope with the mood changes from prednisone. Problem is, St. John's wort causes lots of drug interactions. And one of those is with the way your body breaks down prednisone in your liver. We do not want to interfere, again, with the way prednisone is being broken down in your liver. So let's just avoid St. John's wort while on prednisone. The fourth vitamin that you should not take while on prednisone is calcium alone. Calcium is being depleted by prednisone. When you take prednisone, your body is messing with the calcium system. It's causing all sorts of changes to the way your body uses calcium. If you were to take calcium alone, it's not really going to help your bones, even though that might be why you would take it. What it might actually do is increase your risk for heart disease, because if you only take the calcium, then the calcium isn't being told where to go. It needs messengers. It needs these signals to tell it, go from the blood into the bone, build bone. And if you'd only take the calcium, it just floats around in the blood and can be deposited in the blood vessels, leading to hardening of the arteries. In fact, there's a test they can do. They can do an ultrasound right here of the carotid artery to see how much calcium is deposited there. That's a great test to see what your risk for heart disease is, like how progressed your heart disease is. If there's a lot of calcium deposited here, that's bad news. So we do not want the calcium floating around in the blood. That's not our goal. Instead, do not take calcium alone. Take calcium with vitamin D. They did a study. An analysis of properly conducted trials concluded that supplementation with vitamin D and calcium was more effective than placebo or calcium alone in protecting against corticosteroid-induced osteoporosis. So if you want to protect your bones against osteoporosis, you need at least vitamin D along with calcium. And the doctors who prescribe prednisone the most, who are called rheumatologists, came up with a guideline. They said they recommend 1,000 milligrams of calcium and 400 to 800 international units of vitamin D per day in the prevention of osteoporosis. Vitamin D isn't the only thing you're going to need, though. You actually should also have vitamin K2 and magnesium to help drive that calcium into the bone, to give those signals. And so if you're wondering, well, what's the best way to get that? I personally had to take prednisone. I have family members with osteoporosis, and I did not want to go there. I did not want to have those risks. And I felt horrible while I was on prednisone. And I thought of all the side effects I was going through. And I discovered that if we replenish the nutrients prednisone depletes, from calcium to vitamin D to chromium, which is causing the weight gain and the sugar issues, if we replenish all of those, we feel so much better because we're giving our body the nutrients it needs while on prednisone. So I invented a supplement. I call it Nutrinize Zone. It's the first and only supplement for people on prednisone, and it gives back all of those nutrients you need. Plus, I found other supplement ingredients in here to help counteract other side effects. So you just go to nutrinize.com and you can get it today to help support your body while you're taking prednisone. 3 drugs to avoid while taking prednisone. Hi, I'm Dr. Megan, your prednisone pharmacist, and there are 3 drugs you need to know about that you need to avoid while taking prednisone. In addition, I've got a few bonuses. I also have 3 drugs you need to be careful about. Definitely make sure your doctor's aware you're taking. And then finally, 3 drugs you may need to take because you're taking prednisone and it's causing side effects. So, what are the first 3 drugs to avoid while taking prednisone? First, we want to avoid ketoconazole. This is an antifungal drug, and any other drugs that end in azole that are antifungals. And this is because the way prednisone is broken down by your liver. So we want to make sure that when you take the prednisone, that it goes all the way through your system, that when you swallow it, it goes into your stomach, and then your liver can break it down and your body can use it properly, and then you can get rid of it properly. And if you take these 3 drugs I'm about to tell you about, they may not allow the proper breakdown of prednisone. And so you may get too much prednisone in your body, and that can increase your risk for prednisone side effects, or it can increase your risk for these other drugs side effects. And we don't want any of those things. So first is ketoconazole. If your doctor prescribes prednisone and another doctor prescribes ketoconazole, you need to let them know that you're taking prednisone because that's a drug interaction. Same goes for the second drug, and that is anti-seizure drugs. So if somebody has a seizure disorder or epilepsy disorder, and one doctor's prescribing prednisone and another doctor is like the neurologist prescribing the seizure medications, they both need to know about each other because there are some seizure medications that are not safe and others that are. So the ones that people need to specifically avoid include phenobarbital, phenytoin, and carbamazepine. These are classic drugs that cause drug interactions with things like prednisone. And the third drug to avoid while taking prednisone is verapamil. This is a drug that can be taken for blood pressure, for heart rate issues, for arrhythmias, and other heart disease things that often your cardiologist would prescribe. And so if your one doctor is prescribing prednisone and your cardiologist is prescribing things for your heart, they need to know about each other because the verapamil can interact with the prednisone, causing issues with too high of prednisone, and the verapamil and the prednisone just don't go well together. So those are the 3 drugs to avoid while taking prednisone. I also have the 3 drugs to be careful about to make sure that both doctors prescribing these medications are aware of the other so that the proper measures can be taken. So first of all is that prednisone is an anti-inflammatory drug. It is a steroidal anti-inflammatory drug. So any drug that is a non-steroidal anti-inflammatory drug needs to be avoided. So an over-the-counter example is ibuprofen, but the prescription versions need to be avoided as well, or at least your doctor needs to know about. Those things include Mobic or meloxicam, Celebrex or celecoxib, and there are many others that your doctors could prescribe. So be sure all of your doctors know you're taking prednisone so that they can take the proper precautions. Second is thiazides, thiazide-like diuretics. So these things are like HCTZ or hydrochlorothiazide. This medication is one of the most commonly prescribed blood pressure medications. That's because it works super well. It's an amazing drug that has clearly saved lives. Like there's proof that this drug has saved lives. But the problem is it causes your body to pee out too much potassium. And that can lead to what's called hypokalemia or low potassium. And prednisone also causes your body to pee out too much potassium, leading to hypokalemia. And so the combination of prednisone and HCTZ can cause too much potassium to be excreted in your urine. And so your doctors both need to be aware that you're taking these medications. And a third medication might need to be prescribed along with it called potassium chloride. And so make sure they're aware. And make sure they're monitoring your potassium, that you're getting blood tests frequent enough. Third medication to be careful with is an anticoagulant called warfarin. This is also known as Coumadin, and this drug is fantastic for people who have a lot of blood clotting issues, and it definitely saves lives, but it causes a drug interaction with prednisone. The problem with Coumadin and prednisone is that prednisone may increase the anticoagulant effect of the warfarin. That means you may have a higher risk for bleeding, and it may increase the number that your doctor's measuring in your blood called the INR. And they'll have to adjust your dose of the warfarin. So you just got to make sure that the doctors are both aware that these two drugs are being prescribed. Finally, the 3 types of drugs you may need to counteract prednisone side effects. So people taking prednisone have more side effects than any other drug. And some of those side effects may lead to you needing a specific medication to counteract that side effect if you're going to have to continue taking the prednisone. The first one is prednisone causes increased blood pressure. And this happens to most people taking prednisone. And so your doctor needs to monitor your blood pressure and may need to prescribe a blood pressure medication. Obviously, it probably shouldn't be HCTZ, but there are hundreds of blood pressure medication options. And so definitely talk to your doctor and see which one is best for you. And be sure that they check your blood pressure at every visit. Second is blood sugar medications. Prednisone is in the class of drugs called glucocorticoid. Gluco meaning glucose, meaning sugar. It is affecting blood sugar. So your risk for blood sugar problems like diabetes is way higher while on prednisone, because it's actually causing your body to change the way it breaks down and uses sugar. So you may need either a temporary or a permanent prescription for blood sugar medications. So make sure your doctor is also checking your blood sugars and preventing you going into full-blown diabetes and all the complications that can come with that. Finally, the third medication you may need to start taking because of the prednisone side effects is anxiety or depression medications. Prednisone causes psychiatric side effects in many people, especially the higher the dose you take. And so you may temporarily or permanently need to take a medication to help deal with the mood changes that come from taking prednisone, whether it's anxiety, depression, psychosis, or anything that can change your mood, change your personality, change the way you normally feel. Prednisone is well known for causing these psychiatric complications. So you may need to take a psychiatric drug. I have a bonus fourth medication, and this one is fantastic. So they actually did a study recently to find out that there is one medication that may help with moon face from prednisone. So check out my video all about this fantastic medication that might help with moon face. And if you want to know more about what else to avoid while taking prednisone, I have a downloadable PDF of all the things to avoid on prednisone, from foods to vaccines, the specific ones that you need to avoid. 3 over-the-counter medications you may need to avoid while taking prednisone. Hi, I'm Dr. Megan, the Prednisone Pharmacist, and I'm here to share with you 3 things you need to avoid when it comes to over-the-counter medications. But I have a bonus for you. How about 3 over-the-counter medications you may want to take to help prednisone side effects? Now, I've been a pharmacist for 15 years, and so I've seen a lot of over-the-counter medications and a lot of prescriptions for prednisone in my time. So what do you need to avoid? Well, the first thing to understand is that prednisone is a steroid. It is a corticosteroid or a glucocorticoid. And that is exactly why we're going to need to avoid the over-the-counter medicines I'm about to tell you about. It is a steroid and it works. How does prednisone work? What is it used for? It is an anti-inflammatory. It turns down inflammation. Any disease that ends in itis means inflammation, and it's going to help turn that down. And so the medications that are used over the counter for inflammation and pain, we need to avoid because they are non-steroidal anti-inflammatory drugs. The first one is the most common one you'll see, and it's called ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug. Another name for it is Motrin. Another common one you'll see is Advil. Advil, Motrin, ibuprofen. It's all the same thing. And we need to avoid it because it is working in similar pathways in our bodies. So prednisone is using one pathway to get rid of the inflammation. And ibuprofen is using a similar and yet different, but similar enough that it's causing a drug interaction. And why would you care? Well, because this is causing a side effect called ulcers or GI upset or gastrointestinal problems or holes in your stomach. There's many ways you can call it GERD, gastroesophageal reflux disease. Essentially, when you combine these two drugs, prednisone and ibuprofen, what it can do is make it so that the gut lining isn't as strong as it otherwise would be. And so you may get a hole in your gut or a thinning of the gut lining. And if you get a hole, that can lead to bleeding. And people actually have died from gastrointestinal bleeding because of this kind of a drug interaction. So we want to avoid that if possible. There are other medications in the same class of drug as ibuprofen. That includes naproxen, which is also over the counter, but there are also prescription versions of NSAIDs, such as meloxicam or Celebrex, and there are a whole bunch more. But those are the most common ones that you might be prescribed by your doctor. So you'll want to avoid any NSAIDs with prednisone unless you first get clearance from your doctor that this combination is okay. For some people, it is okay. For some people, the combination is worth it because you might have so much pain that you're willing to run the risk of that GI upset. But for most people, that's not a risk worth taking. So I would recommend to avoid this combination if at all possible. Now, you might have some questions about this combination. If you absolutely have to take it, one and the other, is there a better way to do it? And yes, there is a better way to do it. Taking ibuprofen at least 24 hours after your last dose of prednisone is the best way to do it because then the prednisone's completely out of your system. Or vice versa. If you take the prednisone at least 24 hours after your last dose of ibuprofen, that's a good combination as well. What about aspirin? So aspirin is another drug that is working in a similar way. It's used for a similar reason, right? It's used to help with pain and inflammation, often for headaches and things like that. So we want to avoid aspirin as well. So the first was ibuprofen, the second was naproxen, and the third is aspirin. Those are the 3 over-the-counter medicines you want to avoid. But I have a bonus for you. How about 3 over-the-counter medications you may want to take to help prednisone side effects? So first, you might be wondering, well, if I can't take ibuprofen and I can't take naproxen and I can't take aspirin with prednisone, what do I do if I get a headache? Well, there is one option that's over the counter that you can take, and that's generally accepted as Tylenol. You can take Tylenol, which is also known as acetaminophen or APAP. Anything with that active ingredient, acetaminophen, in it is generally approved and safe for people on prednisone. But what's important to know about Tylenol is that there's a maximum dose you can take per day. It can be quite hard on the liver, and so you want to make sure you're taking 4,000 milligrams or less per day because otherwise it can be harmful. And it depends on if you already have liver problems. You might need to have a lower maximum dose than that. And so what's really important is there are lots of medications that might have acetaminophen hiding in them. So obviously, if it says Tylenol, it probably has acetaminophen in it, but it might not. There are actually things that have Tylenol in that say Tylenol that may not have acetaminophen. They might have another ingredient similar, but isn't actually acetaminophen. And then there might be things that you think have no acetaminophen and they do. So you got to check the back of the label to make sure whether it says acetaminophen or not, and take less than 4,000 milligrams per day. So for example, this one has 500 milligrams in it. And so it's the extra strength tablet. And you'll want to keep your maximum of this one is whatever 4,000 divided by 500 is. That's 8 tablets per day. So you want to take less than 8 of these per day to get the pain relief you'll need while taking prednisone. What else can you take to help counteract side effects as an over-the-counter medication? So I mentioned that the combination of these two drugs can cause stomach upset. So what could you do? One thing you can take is an antacid containing calcium carbonate. That way, it's giving calcium to kind of help coat the stomach, and that can ease the stomach upset. But this isn't going to prevent ulcers. It's just going to kind of ease the symptoms that you're experiencing. But what is really great about this is it contains calcium. And everybody who's taking prednisone for more than 3 weeks is supposed to be taking some form of calcium the entire time they're taking it. So this is one way you could get the calcium you need. Another stronger option to help prevent that upset of your gastrointestinal system is called omeprazole, or anything else ending in prazole. So you can compare this to Prilosec OTC, and other ones include Protonix or Nexium. There's a whole list of other medications that end in prazole, and any of those could be helpful to help prevent that side effect. So if you absolutely must take prednisone and ibuprofen, then you also need to take omeprazole along with it to counteract that side effect. This is what you should do. If you have to take these two, then you also have to take the third one to counteract that side effect. So these are 3 helpful over-the-counter medications that you can take to help counteract prednisone side effects. And I have an entire list of things that you should avoid while on prednisone. And if you would like a copy of my list of things to avoid while on prednisone, just click the link below and download it now. There are 3 shots you should avoid while taking prednisone. Hi, I'm Dr. Megan, your prednisone pharmacist, and I personally had to take prednisone. Plus, I'm a board certified doctor of pharmacy, and I want you to know which shots to avoid while taking prednisone. It was a question I had to deal with because they were wondering whether they were going to have to give me special shots if they had to take out my spleen to deal with what I was taking prednisone for. So this is a question I personally had to deal with, and I've gone deep into the literature to find out exactly what you need to know about which shots to avoid while taking prednisone. First of all, what we need to understand is that most vaccines are just fine for people taking prednisone, but there are a few that you need to be aware of. So what the real problem is when those vaccines are called live vaccines. That means that it is not a killed vaccine, it's a live attenuated vaccine. That means it's an actual virus that is floating around. It might have something broken down about it, or it might be really super diluted in some way, but it's an actual live thing that they're going to put in your body. And they have to use that version in order for your body to make an immune response. The problem is that requires a proper immune system. And while on prednisone, you do not have a proper immune system. That's because prednisone is often prescribed as an immunosuppressant. It is suppressing your immune system. It's designed to do that to help with autoimmune conditions where the immune system is out of whack and is attacking itself. So we want to avoid those that require an immune system that is working properly. All right. And so the live vaccines you need to be aware of include, first, the flu shot. So most flu shots are just fine. The actual shot that goes in your arm, that is just fine. That's most of the shots that they give for the flu. But there is an actual kind of flu vaccine that is not a shot, technically. It doesn't use a needle, it's an actual nasal spray. The nasal spray version of the flu vaccine is not safe for people on prednisone. So I recommend that if you are on prednisone, you don't get the nasal spray, you get the flu shot. And I have a whole long video and blog post with the best information you need to know, updated annually, about the flu shot and prednisone. So check that out. So when it comes to the nasal spray, the problem is it's causing, like, they have to actually put it in your nose instead of straight into your body. And that means your nasal passages have to react to it. That's why it has to be live. And that method isn't safe for people on prednisone. So that's the first one. The second one is the measles, mumps, and rubella, or MMR vaccine. For most people taking prednisone, this isn't a concern because you probably got your MMR as a small child. So for most people, this is irrelevant. But the third one is chickenpox. And again, most people who are currently taking prednisone got chickenpox as a child. So you're like, why do I need a chickenpox shot? So children nowadays get the chickenpox shot, so they never have to go through what people my generation and older had to go through and getting the terrible pox scars and everything. But if you have had chickenpox as a child, then later on down your life, you are at a greater risk for what's called shingles. This is a reactivation of the same virus that causes chickenpox because it never actually goes away. It's actually hiding in your nerve cells. And when you are immunosuppressed, it can reactivate and cause really painful rashes on usually on your torso. And like, people will say, I can't even wear my shirt. Like, I can't even lie down. It's incredibly painful, and you just don't want to have to deal with that. And so you get a vaccine to prevent the reactivation of that. And there's two options for this. The first one is a live vaccine, and it is called Zostavax. And Zostavax was the first one that came out, and it is not safe for people on prednisone because it is a live vaccine. But the second one that they came out with is called Shingrix, and it is not live. It is a recombination of the virus. It's called a recombinant virus. And so it is fine for people on prednisone. Avoid Zostavax, and Shingrix is the one I would recommend. If you are over the age of 50 and you have history or family history of shingles, or you just want to never have to deal with that, then that's the one I would recommend. There are a few other live vaccines I want to mention, but most of these are not applicable to most people on prednisone. First is rotavirus. This is normally given to infants, like very young newborns. And so most people on prednisone are not newborns. Second is the yellow fever vaccine. This is only necessary if you are traveling to a place where there's yellow fever, which for most people on prednisone that I'm talking to on this YouTube video are not traveling to a yellow fever zone. And third is a smallpox vaccine. Similar story. Most people taking prednisone are not traveling to a place where there's smallpox. So those are the live vaccines that you should avoid while on prednisone. I have a bonus of 3 myths that I want to share with you. Before that, I wanted to explain what immunosuppression is. Immunosuppression, as defined by the CDC, the Centers for Disease Control and Prevention, is defined as a substantially immunosuppressive steroid dose is considered to be greater than or equal to 2 weeks of daily receipt of 20 milligrams or 2 milligrams per kilograms of body weight of prednisone or equivalent. So if you have been taking prednisone for 2 weeks or more, and you've been taking 20 milligrams or more, then you are considered immunosuppressed. And everything I've said in this video applies to you. And if you've been taking prednisone for less than 2 weeks or for less than 20 milligrams, you're kind of in the gray zone. And I go through that specifically in my flu shot blog, all about it, so you know exactly what to do. So for those people who do fall under that definition of immunosuppressed, they are not live vaccines. They are other vaccines that the CDC says to avoid if you are immunosuppressed. and those include the dengue virus. And dengue is a condition you're probably not going to get if you live in the United States of America, unless you go to an endemic zone where you're going to have to deal with dengue and you've been infected in the past. So that's probably one that doesn't really matter to you. So then let's go to the myths about prednisone and immunosuppression and vaccines. So first of all, there are some vaccines that people may have thought you needed to avoid in the past, but it's not true. You don't need to avoid them. And the first one is the HPV, which is human papilloma virus, and that is given to young children, not young children, 11-year-olds generally, who are going to prevent an HPV genital sexually transmitted disease that can lead to cancer. And so if you're over the age of 11 or older, the max age is somewhere like about 19 to 20. So if you're beyond your 20s, this doesn't apply to you. And then another myth is that you can't get the Tdap. So the Tdap is tetanus, diphtheria, and acellular pertussis. And that one is fine to get. People thought you couldn't get it if you were immunosuppressed, but it is okay to get it. And then the third one is back to rotavirus, which is for infants. They used to thought you couldn't give it to the infant if there was someone else in the house who was immunosuppressed, but that's not true. So it's fine, even if a family member is immunosuppressed, for the child to get a rotavirus vaccine. So the final and most important myth is that you can't get any vaccines while on prednisone. And that's not true. Most vaccines are fine while on prednisone. The big caveat there is you're immunosuppressed. So you may not have as robust or a good immune response as you would otherwise get. So whether it's the COVID vaccine, the flu vaccine, or any other vaccine, if you're taking high doses of prednisone, you may just not be able to mount as good of a response and get the same effect that someone else would have if they have a normal immune system. So after you stop taking prednisone, there's a chance you may need to be revaccinated. And that is a great question to ask your doctor. So I've gone through the 3 shots to avoid and 3 myths about shots when it comes to prednisone. And if you would like to know more things to avoid, I'd recommend you download my list of things to avoid while taking prednisone. It's everything from foods to vaccines to over-the-counter medicines to full-blown prescription medications that you should avoid while taking prednisone. Click the link below to download it now. 9 supplements to avoid while taking prednisone. Hi, I'm Dr. Megan, the Prednisone Pharmacist. I'm here to share with you 9 supplements that you're going to want to avoid while taking prednisone because they can either cause a drug interaction or make it so the prednisone doesn't work very well. So, without further ado, here are the 9 supplements to avoid while taking prednisone. First, we want to avoid aluminum hydroxide containing things. This can include Tums and other Mylanta, things to help with upset stomach, Maalox, things like that. Not all Tums and not all Maalox and not all Mylanta things include aluminum hydroxide, but you do want to avoid aluminum hydroxide because it does block the absorption of prednisone. Up to 40% of the prednisone is basically bound up into this aluminum hydroxide complex, and it's not going to be absorbed. So if you were normally taking 10 milligrams, if you take aluminum hydroxide with it, it's as if you're only taking 6 milligrams. And so you don't want that. You want to get exactly the amount of prednisone you're actually taking. The second one is St. John's wort. Now, St. John's wort would make perfect sense to me for someone to take because it's often used to help with depression. However, it is broken down by a cytochrome P450 enzyme in your liver that will block the breakdown of prednisone. And so we do not want to take St. John's wort as a supplement while taking prednisone. It's a really bad combination. Next is licorice. Now, licorice makes a lot of sense to me because this is an adrenal support ingredient, often used in supplements that help people build back up their adrenals if they have perceived a loss of adrenal function. However, the licorice will directly counteract
the prednisone. We do not want to take licorice or other adaptogens while taking prednisone. It's just not the right time to be worrying about your adrenal system. The fact is, while you take prednisone, you have effectively turned off your ability to use your adrenals to make cortisol and other steroids. And so just don't worry about it until you're way below 2.5 milligrams prednisone equivalent or lower before you even consider thinking of taking a licorice. And it's like the licorice root and not like the candy. Want to make sure you know there's a difference. We want to avoid those because it can really mess with your ability to use the prednisone properly and eventually recover your adrenal system. Number 4 is alfalfa. Now, people might use this because prednisone is causing high cholesterol or other issues with the metabolism. But again, this is causing a drug interaction. We want to avoid that. Number 5 is activated charcoal. Now, I can totally see somebody gaining weight from prednisone and thinking, oh, I need to go on a charcoal cleanse. Now is not the time. While you're taking prednisone is not the time to go on an activated charcoal cleanse because the charcoal is like a sponge and it will just suck up the prednisone, and then that's going to cause adrenal insufficiency. You don't want that. Just avoid activated charcoal while you're taking prednisone. Number 6 includes lily of the valley, and this is a common weed that can be poisonous, and the combination with prednisone is not good. Number 7 is buckthorn or alder buckthorn. Again, just don't do it while on prednisone. It can, people might use it to help with as a laxative, but it's going to cause low potassium, and prednisone itself is causing low potassium. So you might get extremely low electrolytes like potassium, and that would really not be good for your body. You never want to mess with your electrolytes in that way. Number 8 is grapefruit. Now, technically, this is a fruit and not necessarily a supplement, but you could supplement with it. And it is because grapefruit has in it the ability to block the enzyme that breaks down prednisone. So you'll have extra grapefruit in your body. Number 9 is a common one. This is ashwagandha. It's become really popular in recent years. And ashwagandha, people might think, oh, I'm feeling really stressed and I need this stress relief supplement and I need help supporting my immune system. However, ashwagandha might stimulate the immune system too much. And if your doctor is prescribing the prednisone for an autoimmune condition, ashwagandha might stimulate the immune system too much and be fighting against the way prednisone is trying to help you. Again, people might think, oh, I'm having joint pain and that's why I'm taking prednisone, so I should take turmeric because it can help with joint and other inflammation. However, turmeric can cause a drug interaction with prednisone because it's broken down by the cytochrome P450 3A4 enzyme, and it's blocking that. So the prednisone won't break down properly. So again, avoid turmeric while on prednisone. And finally, I have a few bonus questions you might have of other supplements that you might think, is this safe? Can I use it? What do you think, Dr. Megan? So some questions people have asked me in the past include, can I take melatonin with prednisone? And yes, I definitely recommend taking melatonin with prednisone because prednisone and other steroids have been shown to diminish our ability to make melatonin while taking it. And we don't want to avoid melatonin. You can take melatonin while on prednisone. What about nature's Ozempic, the weight loss supplement berberine? Generally, berberine is okay to take while on prednisone, and it can help with 3 of the most complained about side effects: weight gain, high blood pressure, and high cholesterol. So it's a great choice. What about cannabis or CBD and prednisone? Now, this one's pretty nuanced because CBD can cause a drug interaction with prednisone, but it depends on the other drugs that you're taking, whether or not this actually matters. I have a whole interview I did with a CBD expert where you can learn all the nuances of what you need to know about CBD and prednisone. Check that out. Finally, what is one that a bonus of what you should avoid on its own? And this is calcium. You want to avoid calcium all by itself because calcium, if you are not adding on the other nutrients that it needs alongside it, like vitamin D, magnesium, to get the calcium into the bone, then it might deposit in your arteries and cause artery hardening or calcification. We don't want that. Prednisone's already causing heart disease. So let's not have hardening of our arteries. And make sure if you take calcium, you take it along with other bone support ingredients. So if you're thinking, oh my goodness, that was a long list of things to avoid, Dr. Megan, is there an easy way to remember this? And yes, I created a downloadable PDF of not just the supplements you need to avoid, but also the vaccines, the vitamins, the drugs, and even the foods you need to avoid while taking prednisone. So just click the link below to download the 25 things you need to avoid while taking prednisone. Foods to avoid while on prednisone? Lots of people want to know, what's the best way to deal with food while I'm taking prednisone? Great question, because eating is one of the most impactful ways you can minimize your side effects, what you're choosing to eat. So can you eat these foods? Well, let's talk about it. So the underlying principle with prednisone is what it does to our metabolism when we take it. I personally had to take it. I gained weight. I made mistakes. I learned from those mistakes. And now I have great advice for you. Prednisone is in a class of drugs called glucocorticoid. It's named after the effect on blood glucose, meaning what it does to your sugar in your blood. So we want to help our metabolism avoid the bad changes that can happen when we're taking such an incredibly high dose of this medication. It saves our lives, but if we use our diet choices wisely, we can minimize side effects. Which side effects might we be minimizing? Well, prednisone leads to weight gain in approximately 70% of people. Moon face, which is the round face like the moon, no defined chins or smile lines for people with moon face. Belly weight gain and muscle loss from the arms and legs. One person described it as feeling like a watermelon with toothpick arms and legs. It's really how it feels. So what can we do? Well, now that we know that the most important principle is that prednisone affects our sugar metabolism, what we need to do is eat foods that support healthy blood sugars. And the first thing to do is to avoid foods containing sugars that are ultra processed. So if it contains high fructose corn syrup, not a good idea while you're on prednisone. If it's a type of food that your great-great-grandmother would not recognize, you need to avoid it while on prednisone. Refined sugars are added to so many things. And you can tell because it'll say includes, on this case, 11 grams of added sugars. It has added sugars on the nutrition facts. It's generally not wise to consume that food while on prednisone. It makes a lot more sense to eat foods that have naturally occurring sugar instead of added sugars. That means avoiding pastries, brownies, cookies, donuts. Obviously, candy, soda, if it has added sugars and even fake sugars, can kind of trick your metabolism. Syrups, jelly, white sugar, pretty much added to anything, bagels, and fat-free foods. Normally, they achieve palatability, like they taste good when they're fat-free, when they've added sugar to replace the fat. So avoid fat-free foods as well. Number 2 principle is avoid packaged foods. Essentially, if it comes in a box like this, it's probably not a good food choice. If it comes in a bag that was recently in the ground or on a tree, that's usually a good choice. So that means avoiding chips, crackers, cereal, pasta, instant meals, like frozen pre-prepared meals. These usually spike blood sugar and offer little nutritional value. It's really important to be adding nutritional value because prednisone is depleting your body of protein. It's depleting your body of micronutrients like chromium, magnesium, potassium, calcium. So it's really important to eat foods that are rich in these nutrients and avoiding those that don't give you the nutrients you need while on prednisone. The other type of effect prednisone has on the body is it's affecting your water balance. The amount of sodium and potassium that your kidney is moving in and out, the amount of sodium, potassium in and out of your cells and in your blood, it's changing that ratio. It's telling your body to hold on to sodium and waste potassium. You're peeing out potassium that you really need and holding on to sodium. The consequences of that are that when there's too much sodium, then the body has to hold on to water to compensate for it, to keep the ratio of salt to water in your blood in balance. When you have too little potassium, that leads to swelling, water weight gain. Potassium is important for your heart, so it leads to heart rhythm changes, heart blood pressure changes, and many other consequences. So you want to avoid foods that have salt, excess salt. The salt is added to make it taste good. For example, this has 55 milligrams of sodium. That's not too bad, but they're having to add the sodium to make the product taste good. So you want to minimize the use of salt in your diet. Some examples of high sodium foods to avoid: pizza, cured meats, lunch meat, canned soup, back to the frozen dinners. Basically anything instant or prepackaged usually has a lot of salt added to make it taste good and to preserve it. Next, we want to limit caffeine. Caffeine can worsen that heart complication because caffeine is stimulating on your heart. It can also worsen osteoporosis. So the most important thing is to avoid caffeinated sodas with sugar in them. That's basically the worst source. Coffees and teas are, more of a gray zone, but definitely the energy drinks are pretty much the worst choice of a food you can consume while on prednisone. Next, minimize alcohol intake. Alcohol not only is often high in carbohydrates or sugars, leading to worsened blood sugars and weight gain, they're also linked to bone loss. Prednisone causes osteoporosis as the number one drug source of this problem, and alcohol can worsen that. In addition, alcohol can worsen the adrenal recovery because prednisone is replacing cortisol, your naturally occurring stress hormone, and turning off your ability to make it. Alcohol can make it even harder to recover that ability. Plus, it can worsen the weight gain. Like everybody's heard of a beer belly. Well, the prednisone beer belly is a harder thing to avoid when you're consuming alcohol and prednisone. Here's the good news though. One type of food that has been vilified for a very long time does not need to be vilified while on prednisone, and that is fat. We do not need to avoid fat itself. Eating foods that are good sources of healthy fats is a great choice. Avocados, for example, really good food choice while on prednisone. Minimizing refined oils, though, especially things like canola oil, is a good idea. Using oils like avocado oil, especially olive oil, should be just fine. Even butter is a great choice, especially unsalted butter. So we don't need to fear healthy fats. It's more important to reduce sugar intake instead. So those are my best tips. I've gotten lots of one-off questions about this over the years. So now I'm going to do a frequently asked questions section. So for the hundreds of questions I've gotten about this topic, here are some of the ones that I wanted to highlight and give you some answers to right now. Prednisone and coffee. Can you drink coffee while on prednisone? You can drink coffee, but minimizing your exposure to caffeine and especially the added sugars people often include is really important. With all of the things I've said so far, it's a question of benefits and risks. If you absolutely need to be eating foods that contain caffeine, that contain alcohol, whatever, that's a choice you can make. But now you know how to make that choice with the potential consequences in mind. It's not black and white. All of this is a very gray area. These are just some ways to minimize your complications. But if you're in the stage of life where survival is all you can do, that's okay too, right? But if you're in a stage of life where you can optimize, then let's talk about optimization. Related to this, should I take prednisone with food, without food? When is the best time to take prednisone? Ideally, you would take prednisone an hour before you woke up, but that doesn't usually work because you're asleep. That would be mimicking your body's naturally occurring hormone cortisol. But since you can't do that, the next best thing is to take it the moment you wake up. Leave your prednisone pill bottle next to your bed with a glass of water and take it right then, before you're even out of bed or right the moment you get out of bed. It used to be the gospel truth that you had to take prednisone with food. The evidence supporting that is very lacking. And so if you are getting stomach upset, you could try eating food with it. Maybe keep like a banana next to your bed to eat with it or something. But it is not necessary to eat food with it. It's more important to me that you take it first thing in the morning to mimic cortisol. You could take it other times of day, but for most people, that's the best time. Can I eat meat? Yes, you can eat meat. And in fact, you should be eating good sources of protein to support that muscle loss that prednisone is causing. It's just best to avoid refined meats like hot dogs, for example. While I'm on prednisone, can I still consume things with protein, such as a protein shake? I go to the gym, so it will feel strange for me to not take my daily protein shake. Also, will I be able to slowly eat foods with sodium and sugar after finishing my 9 days, or will I have to wait for the prednisolone to fully wear off before resuming eating those things? So, can you eat things with protein? Definitely. Should you be eating something like this that also has 15 grams of added sugars, which is 30% of your daily intake of sugar? If you're like the person that this is actually for, who is bedridden and has a very difficult time eating food in general, then this is a good strategy. If you are going to the gym, that means you probably have the energy to do a lot of other things. And so eating a protein supplement that has added sugars is not very wise. Like, that's not the most strategic use of your calorie intake. If you have a protein shake that has minimal added sugars, that's a lot better strategy. And then, will you be able to slowly eat foods with sodium and sugar after finishing the 9 days? Yes, you really need to pay attention to your body, see how you're recovering. Is the ketogenic, even carnivore diet okay? So there's actually like a whole Facebook group all about using the ketogenic diet for people on prednisone. And the proponent of that is like way into it and thinks it's the best strategy. And as far as biochemically, it makes sense to me to go keto or carnivore if that's okay with your budget and okay with your doctor, because for some health conditions for which people take prednisone, it is not a good choice. So be sure to check with your doctor before making that choice. But as far as prednisone itself, it should be okay. What about organic maple syrup? So I mentioned syrup, avoiding that, like for sure avoid all forms of high fructose corn syrup. But organic maple syrup, it's organic, it's from a tree, it's like minimally processed. It's a better choice, right, than high fructose corn syrup, but it's still like a choice of making a simple sugar. And eating fruits is simple sugars. So there's kind of like a dial you can turn. Cutting off processed foods, great. Next level, cutting off refined sugars, great. Cutting off simple sugars, great. Like how bad your blood sugar changes are affects the way you choose this. And so for most people, I think just cutting out this type of food is the best first choice. But if your blood sugar is really getting out of control, then maybe maple syrup is something you could cut out. It's really up to you. What about stevia in moderation? How do you wean yourself off prednisone? So, stevia, as far as sugar substitutes, I think is a good choice. But in general, things that are making you think you're getting sweetness, it's really a struggle whether that's a good choice to do while on prednisone, because your body continues to crave sweetness and your palate still has a hard time tasting the nuanced flavors when you're eating high sugar foods. So you can. It's a better choice than other sugar substitutes. Don't use salt at all or low salt. So you definitely still need to consume sodium in your diet, but we want to avoid added salts. It's not like we're going to 0 milligrams of salt. We want to do more like the DASH diet, where it's like somewhere between 1,500 and 2,000 milligrams of salt per day. But definitely do not exceed 2,000 milligrams a day if you're worried about water weight gain, swelling, and those heart complications of prednisone. What about sea salt or Himalaya salt or pink salt? Can we use them or no? So they contain sodium. Therefore, they are sodium chloride containing products, which, although they are better choices than other salts, it's still sodium chloride. It's still the problem of having too much sodium in your diet. We want more potassium in your diet. So if you want to know what seasoning could I use, I recommend new salt. That's NU salt. And it's actually potassium chloride instead of sodium chloride. That's what you could use instead. How about 85 to 95% organic dark chocolate? I think if it's that percentage of dark chocolate, then there's very minimal added ingredients, minimal added sugars, and minimal added salts. So that's probably a good source of chocolate if you're like me and that's an important part of life. And keto diet may help keep weight gain during steroids. Yeah, the keto diet I mentioned is still an option you can pursue. Next question. Is it okay for me to take Carbo Gain, which contains maltodextrose, to gain weight? It's like 70 grams of carbs for a half a cup, which is the dose. Would that up my blood sugar and be negative for my health, like you said? On the label, it says it's a complex carb. So 70 grams of carbs is a lot. And generally, that much will probably up your blood sugar. You can always get a continuous glucose monitor or just blood glucose test strips and test how it feels on your body. But in general, that is the definition of a refined carbohydrate. It is, I mean, it's not naturally occurring. And with all of these things, you've got to balance what your priority is. Is your priority weight gain or is your priority carb control? And you can't achieve both with that option. Should I avoid sugary fruits? So again, this is back to the turn the dial, avoiding refined sugars versus cutting out all carbs and going keto. There's a spectrum there, and it depends on your goals and your situation. For your typical person on prednisone, eating fruit is a good source of nutrients that prednisone is depleting, like potassium and magnesium. Fruit and vitamin C, like those are good sources of those nutrients that you really need to be consuming. So unless you're like full-blown diabetic or going keto, you don't need to avoid sugary fruits. What about plums, grapes, or kiwi? Is there too much sugar in them? No, I think that's okay. Balance it out with some protein and in the same meal to minimize the blood sugar spikes. Like eat some peanut butter with it, have some hummus with it, something like that to balance it, but it should be fine. What about citrus? I feel dizzy after having grapefruit, lemon, or a simple orange slice. What's up with that? I have no idea why you're having that reaction. I've never heard of that reaction. But in general, citrus is a really good source of vitamin C, which prednisone is definitely depleting. So eating vitamin C is great. What about baked potatoes? I think potatoes are a great option while on prednisone. Potatoes are high in potassium, which prednisone is depleting, and many other nutrients. So I think potatoes are really good, especially baked potatoes, because that releases some of those nutrients that are otherwise trapped. So if it were me, I would eat potatoes while on prednisone. In fact, I love eating potatoes. It's like my go-to lunch. And balancing it out again with some protein in that meal. So whether it's putting cheese on it or some meat with it, beans with it, something to balance out the carbohydrate release is a great strategy. Sour cream, some fat and protein to balance it out. Can whole grains in small amounts be okay? Yes, whole grains are a great option. If you're going to eat bread, it's better to eat 100% whole wheat bread instead of white bread. Is it safe to eat Jenny Craig food while taking prednisone? So if this is your way of dealing with the hunger cravings and like putting like a framework on your eating, then go for it. But if your strategy is to avoid boxed foods that are high in sugar and salt, this is not a good strategy. So it's like, what is your priority? Are you surviving, like barely surviving while on prednisone, and this is a way to eat? Great, go for it. But if you are more in the optimization phase, then maybe avoid Jenny Craig foods. Can I use a small amount of raw organic honey in smoothies while on prednisone? I use no salt or any sugars, but unclear about raw organic honey. I throw raw organic honey in with organic maple syrup, a good source of carbohydrates. It's unrefined. That sounds like it came straight from the beehive, right? So it's a much better choice than high fructose corn syrup. But where are you on the carb roller coaster? Are you on, I'm just cutting out refined foods, or am I cutting out carbs completely? If you're able to eat carbs, like your blood sugars are stable, you haven't had excessive weight gain, that's a great choice. Can you eat eggs while taking prednisone? I think eggs are a great choice for something to eat. It's rich in many nutrients that prednisone is depleting. Helps you feel full, good source of protein, go for it. Can I eat yogurt while taking prednisone? Yes, yogurt is a good choice, but it depends on the kind of yogurt. Kinds with refined sugars added, like Yoplait, probably not the best choice. The simpler it is, the fewer ingredients, the better. Like if it's really just straight up milk that has cultures added, that's the best choice. But yogurt is a good source of protein and other nutrients while on prednisone. Can you eat bananas while taking prednisone? Yes, bananas are a great source of potassium and other nutrients prednisone depletes. Can you drink milk with prednisone? Yes, definitely drink milk. No problems there. All right. I'd love to hear what other questions you have about what foods to avoid while taking prednisone. And if you want to know what other things to avoid, I have a complete list of not just foods to avoid, but also supplements to avoid, vaccines to avoid, and much, much more. You can click the link below to download it now so you know exactly how to optimize your life while on prednisone. You know what to avoid and what you need. 3 foods you need to avoid while taking prednisone. Hi, I'm Dr. Megan, your prednisone pharmacist, and I'd like to share with you the 3 most important foods to avoid while taking prednisone. And sneak peek, these are actually mostly food groups or food types. And so I personally had to take prednisone and it was horrible. And I gained weight and I felt awful. It saved my life though. So I wanted to know if there was anything I could do to make the experience of taking prednisone better. And I discovered these 3 foods to avoid while taking prednisone. First of all is Morton iodized salt. The cute little girl with her salt in the rain. Salt. You need to avoid salt while in prednisone. And that's because prednisone is mimicking a hormone in your body called cortisol. And cortisol can hit 2 different places in your body. There's a special receptor called a mineralocorticoid receptor. And it is in charge of deciding how many minerals are in your body. Things like sodium, that is in salt, sodium and potassium, and it tries to find the right balance of these things to know how much to pee out and how much to hold on to in your kidneys. And this is a really delicate balance, and prednisone is throwing it off because it's telling it the wrong message. It's making you think that you need to be getting rid of potassium and holding on to sodium, but you don't. So, if you want to avoid that, we need to stop eating foods that are high in sodium. And there's a great diet plan created by the doctors who prescribe blood pressure medicines called DASH, Dietary Approaches to Stop Hypertension. And so you can follow that DASH diet to help with getting low sodium in your diet, avoiding salt as much as possible because salt is sodium chloride. Second, prednisone is not only a mineralocorticoid, but it is also a glucocorticoid. This might sound Greek to you because it kind of is. It's Latin. And gluco is glucose, which is sugar. And so we need to avoid sugar. Things like this confectioner's sugar. This is highly processed sugar that is going to cause dramatic blood sugar spikes in most people, but especially when you're taking prednisone, because it is changing the way your body breaks down and uses sugar so that you're not able to deal with sugary foods like you normally used to be able to. And so when you might be able to tolerate eating a lot of sugar before, now you might actually get what's caused glucocorticoid induced diabetes. And that's no good. You do not want to get diabetes because you had to take prednisone. So you need to avoid foods containing sugar. Plain sugar, white sugar, confectioner's sugar, brown sugar, as many of the different kinds of sugars as you can. Eating foods that are whole foods, like whole fruits, and not fruit snacks, because those are really just sugar candy. So that's the second food to avoid. And finally, the third food to avoid looks kind of like this. This is the most giant orange I've ever had, but it's actually supposed to represent a grapefruit, but I didn't have any grapefruit. So you need to avoid grapefruit while on prednisone. And that is because prednisone is broken down in your liver by what's called an enzyme. And the specific kind of enzyme that prednisone uses is called CYP, or cytochrome P450 number 3A4. So CYP 3A4. That's what prednisone is. It's like prednisone goes in and it's held by this and it's broken down by it. And that's how your body uses it properly and gets rid of it properly. And what's cool about grapefruit is it blocks that. And so if you eat grapefruit and then you take prednisone, your ability to break down prednisone will be impaired. And you might have more prednisone in your blood than you normally would. And so if you if you eat grapefruit every day and that's just a thing you do, then by all means keep doing that. But just know, if you change the amount of grapefruit you're eating, if you like suddenly go on a grapefruit cleanse or something, or you're trying to get down low on your dose of prednisone, you're trying to taper off, taking prednisone and grapefruit in like a sporadic manner may make it so you have more prednisone on board, even at the exact same pill dosage strength. And so you just want to keep it consistent, whether it's every day or never. You want to keep it consistent. So those are the 3 foods to avoid while taking prednisone. If you'd like a complete list of things to avoid while taking prednisone, you can download my checklist of things to avoid while taking prednisone. Should you avoid rice while taking prednisone? I got this question from a prednisone warrior in response to my video called Foods to Avoid While on Prednisone. And so I thought I'd record a quick video to respond. Now, this is not medical advice. This is general information about prednisone. And so I just wanted to make sure before I answer it that you know that. And this is the specific question that @Rex Gaming TV14 asked me. He said, I'm taking almost 3 years of prednisone 20 mil, and I notice my sugar getting up. Should I avoid rice? So prednisone is a glucocorticoid. That's the type of drug it is. It is mimicking our naturally occurring hormone, cortisol. And cortisol is responsible for keeping our body safe in emergencies. And one of the ways it does that is by increasing our sugar in our blood. And so it's changing your metabolism. And everybody's metabolism changes at a different rate. But after 3 years of 20 milligrams of prednisone, that's a lot of prednisone that you've been exposed to, a lot of changes that have been made to your metabolism. And so in your situation, it might make sense to avoid rice, at least white rice, and other simple carbohydrates that can dramatically affect your blood glucose. Some people who take prednisone get to the point where they've found that the keto diet is the best for them to minimize the side effects, the weight gain, the blood sugar changes, because the keto diet is essentially where you eat very few carbohydrates, which are sugars, and you mostly eat proteins and fats. And that keeps your blood sugar more steady and stable. And so some people have found that that's a better alternative. So if you're getting to the point where your sugars are rising, and your options are either change my diet or potentially go on diabetes medications, generally changing your diet is a better strategy. And so I would do what is necessary, potentially get a continuous glucose monitor and test, see which foods are affecting your blood sugar. And it's unique to every single person and every single time of day and every single combination of foods, of how it's going to affect you. And so just test, okay, if I eat plain white rice, it does this to my blood sugar. If I eat white rice with chicken, it does this. If I eat white rice with chicken and vegetables, it does this to your blood glucose. And see, okay, well, if I eat rice, I need to eat it with protein and vegetables too. Does that make sense? So I recommend that you do what you can to minimize your risk for long-term complications and not have long-term diabetes and the complications of that. And so one of the things I recommend you do is to download my prednisone checklist. In it, I include the top 7 mistakes people on prednisone make, and I'll give you a hint. One of them has to do with sugar. And you want to know what the other 6 are, though, right? So you can click the link to download that now. And on there, you can find out exactly what those top 7 mistakes are and what you can do about it. And it's totally free. Just fill out the form, and I'll send it right over via email. Should I avoid sugary fruits while on prednisone? That is what a prednisone warrior reached out and asked me in response to a video I made of the 3 or more foods you should avoid while on prednisone. And the reason I recommend to avoid sugar is because prednisone is a glucocorticoid. Gluco meaning glucose meaning sugar. Prednisone is interfering with your ability to break down sugar properly and use it. And so when you eat foods that are high in simple sugars, it can interfere with your ability to have a healthy blood sugar, which can increase your risk for diabetes and weight gain and lots of complications. So that's why one of the 3 foods I recommend you avoid is sugar. And I'm specifically in this case referring to simple sugars like white sugar, brown sugar, honey, agave, things like that, like sweeteners that you're adding to foods because they are such rapidly absorbed and can rapidly affect your blood glucose. Everybody's different in their ability to tolerate sugar containing foods. So when I'm talking about sugary fruits, I'm talking about some people who have full blown diabetes have to adjust their insulin after they were to take something like eating something really sugary like watermelon or bananas or oranges because it's affecting their blood glucose. But if your only concern is prednisone, then whole fruits are a great source of a lot of the nutrients that prednisone is depleting. So it's about finding the balance between, is this food providing other nutrients besides straight up sugar? And if so, good. And I want you to notice I said whole fruits. Drinking juice is pretty much never a good idea while on prednisone because you're not getting the other plant compounds that help blunt the dramatic blood sugar response. For example, eating a whole orange is great. Drinking orange juice, you've removed the fiber, the pulp, the solid particles that slow down your absorption of all the sugar that's in that juice. And that's making it so that your response to that food is much more dramatic. And so if you're going to eat the fruit, eat it whole, eat the full fruit, not just like if you're going to eat the apple and the skin. Don't cut the skin off. The skin is where like the best nutrients you need while on prednisone are. And so eat a whole fruit. And then if you have diabetes or another condition with impaired glucose response, then you need to work with your doctor on that and make sure you're adjusting your diabetes medications appropriately to what prednisone does to your blood sugars. Aside from that, enjoy your delicious, healthy fruits while on prednisone. And if you have any other questions, put them below. Otherwise, I invite you to watch the video, 3 or more foods to avoid while on prednisone, so you can find out what the other 2 are. Can I take turmeric with prednisone or curcumin with prednisone? I had somebody reach out to me and ask me all about this specific supplement and prednisone because I created a video that you should check out called 9 or more supplements to avoid while taking prednisone. And I included turmeric in here. And so the specific question is, when you say avoid turmeric, does that mean avoid curcumin? I've been on prednisone for 2 days for inflammation. I've been taking lots of vitamin D, quercetin, fish oil, NAC, and tocotrienols. And so essentially, yes, I'm saying turmeric and curcumin. Curcumin is the active ingredient, the actual molecule that is responsible for most of the beneficial effects of turmeric. So you can either have a supplement that's called turmeric, or you can have a supplement that's called curcumin, but essentially it's the same recommendation I'm going to make. So when I say to avoid turmeric, I'm also saying avoid curcumin, especially when you're doing them in high doses. And the curcumin itself is what interacts with prednisone and it can increase your risk for side effects from prednisone. However, if you are just eating turmeric as a spice in curry or other foods, and it's not this giant pill tablet supplement size in a lower just eating dose, then that's probably okay. It's when you're popping 5 turmeric curcumin pills a day that I'm worried about. So eating it in just your normal diet is probably okay. But generally, if you're worried about any supplements, I would recommend you reach out to your doctor to make sure that it's safe for you, because turmeric can interact with other drugs too, not just prednisone. So I'd recommend that whenever you start a new supplement, you ask your doctor to make sure that it's safe and that they recommend that it's okay for you. And if you haven't yet watched it, I recommend you watch my video of the 9 or more supplements to avoid while on prednisone. And it will show you exactly which ones I recommend you step away from while taking prednisone. Signing off is Dr. Megan, your prednisone pharmacist.